Welcome, behavioral health psychotherapists. Today we're diving into a crucial concept that impacts every aspect of your practice: the self-fulfilling prophecy of beliefs and behavior. Your client is convinced they are unlovable, and all evidence seems to point to it. But what if their own behavior is the source of that evidence? This instructional video provides behavioral health psychotherapists with a critical framework for understanding the powerful, often insidious loop between a patient's beliefs and their behaviors. We will explore how our actions, driven by our core beliefs, inadvertently create the very evidence that confirms those beliefs as quoth. This knowledge is fundamental for effective cognitive and behavioral restructuring. Today, we'll define the behavioral loop, explore how core beliefs lead to specific behaviors, demonstrate how those behaviors generate evidence, and finally, discuss practical strategies for breaking this cycle. Let's start by briefly reintroducing the foundational model many of you are familiar with: the interconnectedness of beliefs, thoughts, feelings, and behaviors. Let's call this the lived experience framework. These components are constantly influencing each other in a dynamic system. However, the specific dynamic we're focusing on today is often overlooked. It's not just that beliefs influence behavior. It's that behavior actively validates the belief, creating a powerful feedback loop. Consider this visual aid of the behavioral loop. A core belief, like "I am incompetent," leads to a behavior, such as avoiding new projects. This behavior then results in evidence, like not getting promoted, which in turn reinforces the original belief. See, I knew I was incompetent. To make this concept more concrete, let's look at a few common clinical scenarios where this behavioral loop plays out. Take a client with social anxiety. Their belief might be, "I am awkward and no one will like me." This belief leads to behaviors like avoiding eye contact and giving one-word answers. The evidence they gather is that people tend to disengage, confirming their initial belief. Now, consider a client with trust issues. Their core belief is, "People will inevitably betray me." This can lead to behaviors like acting suspicious and constantly testing a partner's loyalty. The evidence then becomes a partner feeling suffocated and withdrawing, reinforcing the belief, "I was right, people can't be trusted." Finally, for a client with low self-worth, the belief, "I don't deserve good things," might drive behaviors like self-sabotaging opportunities or staying in an unfulfilling job. The lack of career progression or financial security then serves as evidence, validating their belief, "I guess I'm not meant for a better life." Understanding this dynamic is crucial for therapeutic intervention. It shifts our focus from merely challenging thoughts to strategically altering behaviors. It's important to recognize that simply challenging a belief with logical arguments often fails because the patient's evidence feels so strong and real. The therapist must help the patient see that the evidence is, in fact, self-created. This is where behavioral experimentation becomes the core intervention. The therapist's job is to collaboratively design and implement, quote, experiments that directly challenge the patient's belief by changing the behavior. For our social anxiety client, instead of avoiding, the experiment might be, what if you try making eye contact and asking one open-ended question in a conversation? The therapist then helps the patient process the results, allowing them to see how a different behavior led to new, contradictory evidence. This is where the patient begins to see the, quote, evidence in a new light, understanding why this behavioral shift is important for accurate self-perception. To summarize, the behavioral loop is a powerful, self-sustaining cycle where our beliefs influence our behavior, and our behavior, in turn, creates the very evidence that reinforces those beliefs. This dynamic is often at the heart of resistance to change. When a client says, "I have proof that my belief is true," your role as a therapist is to help them critically examine where that proof is truly coming from. We encourage you to look for this dynamic more intentionally in your practice, recognizing that powerful change can occur by targeting the behavioral side of the loop. Incorporate behavioral experiments more intentionally into your practice. Remember, true therapeutic change isn't just about thinking differently. It's about acting differently to gather new evidence and create a new reality for ourselves and our clients.